Hi everyone, I'm Dawn and this is Femme Frequency. Today's episode is brought to you by mystery heat waves, disappearing patients, and the ongoing search for things which are usually within plain sight. If you know what I'm talking about, stay tuned because with me in studio today, I have a young medical doctor, and between the two of us, we are going to try and bridge science and lived experience. Dr. Anique Liebrandt, very, very welcome to Femme Frequency.
Thank you very much, Dawn. Thank you for having me.
It's such a pleasure. Tell us a little bit more about who is Anique Liebrandt and where can the people find you if they need you?
I am Anique Liebrandt. I am a GP, born and bred in Paarl, and then I went and studied at Stellenbosch University, graduated in 2020. After which I then completed my internship at New Somerset Hospital in Greenpoint and then went on and did my community service here in Limpopo. I then came back to Paarl and then started GPing. So I'm currently working with Dr. Melissa Meyer. She is at Meyer Medical in town. Yeah, so you can come find us there.
And are you enjoying it?
I'm loving it.
Fantastic. A Paarl-born girl. We are always very proud of our Paarl people and we love to hype them up.
Thank you so much.
I have a question for you. Hot flashes that arrive like uninvited guests, forgetting why I walked into a room, forgetting my words mid-sentence, crying for no apparent reason, constant mood swings. My husband gave me that one, but I don't know if it's relevant. The question, Dr. Anique, is, am I losing it or is it normal?
Dawn, it sounds to me like you are explaining or describing menopause, and it's not abnormal. No, it's meant to happen this way.
Unfortunately.
Or fortunately, depending on how you look at it. But yes, essentially you are explaining or describing what could be menopause. And so maybe I should just give a brief description of what menopause is. So it's a transition phase in the female body in which the ovaries no longer produce estrogen, right? And estrogen is really your feel-good hormone. So yes, it's responsible for fertility, but it is also responsible for your mood and so many other things, right? And the effects of a reduction in estrogen could present with those type of symptoms. And we often see it in women, middle-aged women, so between the ages of 45 to 55. So that is the appropriate sort of age range for menopause. Anything happening younger than 45, so between the ages of 40 and 45, is considered early menopause, and then anything happening younger than the age of 40 is considered sort of premature ovarian insufficiency. So that would not be menopause, that would be something completely something
different.
Else.
Yes.
Pathological.
But you do find that women go into menopause at different stages of their lives.
Yes. So, but again, like I say, so the clinical sort of age range would be between the ages of 45 to 55. If it happens sooner than that, it's more early menopause. So that's the appropriate age range, but your symptoms can sort of vary and it's very individualized, very person dependent. So how you experience menopause is very different than the next person.
I can't really remember my mum going through menopause. So she was either very good at hiding it or she was one of the lucky ones because, I clearly remember some of the aunts walking about with, little wet cloths around their necks and everybody is forever hot. But I don't remember that. So you say some ladies have it easy and some not.
I think that's very important. So it's very individualized. So your experience is going to be different than the next person's experience. And I think just in terms of how we can maybe think about it, so 10% of women experience very bad menopausal symptoms. So that is your hot flashes, your mood swings, your libido changes, your sleep disturbances, acne or dry skin issues. And then 10% of women don't experience anything at all. And the rest of the women are kind of just in between. But it's very, very individualized. And maybe your mom
was a lucky one.
Maybe she was lucky. Or maybe she just didn't speak about it, because I do think there's also this stigma around it. Yeah.
Absolutely. And especially the previous generation. I think we are much more open about things such as menopause than they were. But as I say, I don't remember it, and I'm hoping that I will also have a smooth sailing. So far, so good. Nothing too bad happening. I do get the odd hot flush at 3:00 in the morning. When hubby wants to pull the blanket over and I just want it off me. But other than that, I think it has been smooth sailing so far.
Blessed.
The next thing I want to touch on is there are various myths about menopause. Things like your life changes completely, or rather it stops when you hit menopause, or there are some stupid things out there that I don't even want to mention on air. But what is the one myth that you would like to debunk about menopause?
Dawn, I think when patients come to speak to me specifically about sort of when they have concerns about menopause, or when I bring up the topic of menopause, they get this look on their face and it's like, my life is ending. But it's absolutely not that. And I think that is the biggest myth that I would like to debunk, is that your life is not ending. In fact, it can be a very, very beautiful transition if you allow it to be. I just think that it's not a swear word, and we should not treat it as a swear word. It's not, we're not cursing.
Absolutely not. And I think the first step towards that is having the conversations.
Yes.
So women must not be afraid to ask the questions that they have. So one of those myths is weight gain is unavoidable. Is it true or isn't it?
So like I mentioned, right, estrogen is responsible, or there are estrogen receptors all over your body, from your brain to your gut to your skin. It's everywhere. So if you are no longer producing estrogen, right, you can have lots of different symptoms. Weight gain, it can happen, unfortunately, because yes, there are estrogen receptors in your gut. Weight unfortunately can happen, but there is also we can manage it. Like, speak to your doctor if you're concerned about it. If you're gaining too much weight, maybe there's another medical reason for it. So I think it's important that you are first of all aware of these symptoms, but then going to speak to your doctor about it, and then having certain investigations done to rule out other causes potentially.
Yes. I do think that many women experience a little weight gain around the waist area. I can absolutely vouch for that. There's an extra layer there that wasn't there before. So it happens.
But it's comforting. It's comforting. It
I
depends
think
on how you look at it.
more so for the husband than for me. But it's not the end of the world. It's not the end of the world. And there are many ways where we can actually disguise it. Mm-hmm. So with all the beautiful clothes out there, we just need to know which ones to wear to make it look a little bit better. Then there's an area of menopause where women whisper about. It's not something that's being conversed about around a dinner table. And one such a thing is libido changes. Mm-hmm. So what is your take on that?
Mm-hmm. So I do agree that you can have libido changes with the onset of menopause. Again, there are estrogen receptors in your brain, and your libido is really, it's triggered from your brain, right? So yes, unfortunately, libido changes can be expected. Either some women are hyper excited while others don't have any libido. And that is, yes, as a result of a lack of estrogen. But again, there's help for that. So together with libido changes, it can also be as a result of mood changes. So the the forgetfulness and the anxiety and depression that goes together with menopause as well. And I think sleep disturbances, they can all affect your libido and your excitement for life.
Beautifully said, excitement for life. I agree with you 100%. And I just do you find that there are many menopausal women experiencing marital problems because of that?
Yes, I do think it causes a lot of marital strain, and perhaps the partner or the husband doesn't really understand the reason. So I always tell women, you know what, when you come back for your repeat consultation, bring your husband along. Let us also educate him so that he can know this is the reason why, this is the medical reason, perhaps why my wife is not as excited as she used to be.
Or overly excited.
Or overly excited, yes, 100%. It's good to know, why things are happening. So we want to inform, obviously, yes, the woman, but also her husband and the partner, because
absolutely,
it's a life change.
Absolutely, and it's something that you have no control over.
100%.
And I think if your husband understands that part, where he knows that it is not a choice that you are making, it's not a headache that you are faking, but it's actually a medical problem, there'll be better understanding.
100%, I agree.
Fantastic, fantastic. Ladies, so go out there, take your husband with you to the GP so that he can know the real reason of why things are happening the way that they are happening. So I want to ask, so a younger woman who has, like yourself, who has not yet experienced menopause, give us some tips for that woman to make it a little bit easier for her when she reaches that stage.
I think that's a good question. Excellent to start early. I think it's never too early to start, just working on yourself. I think general things that we would do in any case, lifestyle changes, eating healthy, those are things that are going to help you later on with menopausal symptoms as well. It's not scientifically proven because, like I say, every woman experiences symptoms very differently. So unfortunately, we can't change that. But just to support yourself later on in life, I think it's important to follow a healthy diet. So eating as close to nature as possible. Strength training, very, very essential. Start early, so at least twice a week. And that doesn't mean you necessarily have to go to the gym. You can do like resistance exercises at home, your planks, your squats, those type of things. And then cardiovascular training, so going for a walk or run or swim or something
being
like
active.
that. Being active in general, yes. And then there are also, I think, supportive supplements that women can start taking also from an early age. So looking at your vitamin D, your calcium, magnesium, collagen supplements, creatine, very, very important as well. Yeah.
Fabulous.
And your omega-3s, of course, sorry.
Obviously, yes. But as you said, diet plays a big role. So cut out the sugars, cut out the excess carbs, just those things that make you feel lethargic in any case.
Yes, 100%. So foods that can cause a lot of inflammation. And you don't want that because they can also contribute to other things like cardiovascular problems and diabetes and all these other lifestyle things. Yeah.
Increase activity and eat right.
100%.
Basic.
What you were going to do in any case.
What we're supposed to do.
What you're supposed to do.
We don't necessarily do that, but we are supposed to do that. And I absolutely agree with you. I just, from personal experience, I cut out sugar. So instead of having a spoon of sugar into my coffee, I now take a spoon of erythritol in my coffee, which is a sugar replacement. You also get xylitol, but I don't particularly like the taste of xylitol. But you get different ones. I think it's important to make sure that the one that you choose is the best one, because there are also quite a few on the market that's not so great for your body. A replacement is not necessarily the better option, and sometimes we get that wrong. So I have made that change into my lifestyle. We try to eat as healthy as possible and cut out the fizzy drinks and things like that. I am now not as active as Dr. Melissa Mayer, who runs half marathons for a living. I'm not there yet, but I do hit the gym at least 3 times a week, and I do strength training. So
Excellent.
Kudos to me.
Kudos to you. And do you feel the difference?
I absolutely do. But for me, another thing about menopause and where the exercise comes in is the mental health part. Because I do think that it puts strain on our mental health also. What is your opinion on that?
I 100% agree with that. Again, estrogen, brain, if it's not there, you can develop sort of mental health symptoms. And I think that's a lot of the complaints that I think women come to me with when they are concerned about menopause. It's the brain fog, the irritability, literally I had a patient who said to me that she hates her husband and she hates her kids right now, and she knows this is not herself. So just to be aware of that, like, yes, you feel this way now, but there's a reason for it. And this is not your baseline. This is not how you normally feel. So yeah, I think mental health is a big thing also surrounding menopause. Yeah.
Yes. For me, definitely the brain fog. I have to say it drives me crazy. I hate when I hit mid-sentence and I suddenly cannot remember what it is that I wanted to say. And you know it's there. You know that somewhere in there, that word is sitting there, but you just cannot figure it out. In general, I'm someone, I hate looking stupid. I don't like that. And brain fog makes me feel stupid. So that is definitely something triggering me mentally.
Yeah.
I do get where your patient comes from when she says, oh, I just hate my husband at the moment, and I hate my kids, and I hate everyone around me. But I think it's also because you kind of lack patience. You are not so patient anymore. You want everything to happen immediately. You get upset when someone walks too slow in front of you at the supermarket. I experienced that the other day, and I was thinking, can you just move to the side? Can I just pass you, please? Can you just move out of my way? So I do get that. And I think mentally, if you are not strong, if you don't seek help, if you don't talk about it, it can lead to some serious damage.
100%. It can spiral out of control very, very quickly. And so I do think it's important for women to be aware of how they feel, and seek help early. There is help for you. You don't have to suffer in silence. I think, sometimes, menopause can definitely cause that, but there can also be other pathological reasons why you might be feeling that. So I think it's very, very important, if you are feeling off of your baseline, go to your doctor, speak to them about this. There is help for you. You don't have to suffer in silence.
Another question that I have, you telling us that there is help out there. There are supplements that you can take. Now, I'm finding myself in menopause. Obviously, you've realized that by now. But I'm not using anything. So I'm not using any supplement. And for me, the reason being is that I'm just not somebody who is comfortable with taking supplements. I always feel that if it helps on the one side, it kind of does something on the other side, which I don't want it to do. So my question is, are there negative side effects with the supplements which will deter me from taking them?
So I think anything that you ingest that is chemically compounded will have side effects, right? A Panado has side effects. Yes, taking too much, for example, of magnesium can cause heart problems. So it's important that you, before you even start taking these supplements, go speak to your doctor and find out what is appropriate for you to take. You might not need to take vitamin D supplements if your vitamin D levels are adequate. So I think it's important to rather, before you make this decision, rather go and speak to your GP, have them do some blood tests and have them guide and advise you on the way forward.
So there's one thing that we've realized today, and that is that menopause is inevitable. But we do not have to suffer in silence. There is help out there. We just have to be brave enough to ask for that help, which is the best advice. And to everyone out there, I want to say we've realized that menopause is a recalibration. It is a start of new things, and it doesn't have to be a swear word. The Cruella de Vil in your body is estrogen, so don't take it out on anybody else. Thank you for tuning in to Femme Frequency, where we are trying to bring clarity, to turn chaos into conversations, and where we even take hot flushes and turn it into life lessons. Until next time, take care of yourself.